After 32 years of delivering babies, I thought I had seen just about everything this job could throw at me. I thought I had held every possible fear in my hands, watched every kind of miracle unfold under those bright operating lights. But then Eliana walked into my clinic on a quiet Tuesday morning in early spring, and something about her made me stop. Not because she was sick, not because anything looked wrong, but because she had that look. That quiet, unshakable certainty that some mothers carry deep inside them, even before their bodies show any signs of trouble. Eliana was 29 years old, a first-time mother who had waited years for this pregnancy. She and her husband had tried for almost 4 years before she finally saw those 2 pink lines appear on a test she had almost stopped believing in. She came to me at 8 weeks, nervous and glowing at the same time, the way women are when they are terrified to be hopeful but cannot help themselves anyway. Her first trimester was textbook perfect. No nausea that she couldn't manage. No bleeding. No cramping. Her blood work came back clean, her blood pressure stayed low, and her anatomy scan at 20 weeks showed a healthy baby boy growing exactly as he should. But here is something I have learned over decades of watching mothers carry life inside them. Sometimes the body lies. Sometimes the numbers lie. The heart rate is strong, the measurements are perfect, the mother is healthy, and still something is wrong. Something that tests cannot see. Something that scans cannot capture. Something that only a mother's instinct can feel, long before any machine confirms it. Around the 26th week, Eliana started telling me that her baby felt different. Not bad, exactly. Not painful. Just different. She said he had always been so active, kicking and rolling, and keeping her awake at night with his little acrobatics. But now, she said, his movements felt weaker, slower, like he was moving through water instead of dancing freely. I ordered a non-stress test, and it came back normal. His heart rate was reactive. He was moving enough by clinical standards. The nurses reassured her. I reassured her. But Eliana smiled the way mothers smile when they are being polite, and I saw something flicker behind her eyes that I should have paid more attention to. What would most mothers feel in that moment? To be told everything is fine when every cell in your body is screaming that something is wrong? To have medical professionals look at you with kind, confident faces while your own heart is pounding with a fear you cannot name? I sent her home that day with instructions to rest and drink more water. And Eliana, trusting us the way patients have to trust their doctors, tried to believe that her instincts were lying to her. But deep down, in a place no ultrasound could reach, she already knew. Her son was fighting for something. She just didn't know what yet. The week that followed was what Eliana later described to me as the quiet before the crash. She went home. She rested. She drank the water I told her to drink. She counted kicks like the nurses had shown her. 10 movements in 2 hours. That was the benchmark. And her baby was meeting that benchmark. Barely, but he was meeting it. So she told herself she was being anxious. She told herself that first-time mothers worry too much. She told herself that I was the expert, and if I said everything was fine, then everything must be fine. But at night, when her husband was asleep beside her, and the house was dark and silent, Eliana would lie awake with her hands pressed to her belly, counting seconds between movements. She told me later that she had started holding her breath between each kick, waiting for the next one to come, afraid that if she breathed too loud or moved too fast, she might miss the moment when the kick stopped altogether. That is what maternal anxiety looks like sometimes. Not loud panic, not dramatic tears, just a woman lying perfectly still in the dark, bargaining with God for one more movement, one more sign, one more day. On the night of her 28th week, something changed. Eliana woke up suddenly at 3 a.m. with her heart racing. She couldn't explain why. She hadn't heard a noise. She hadn't had a nightmare. She just opened her eyes and knew with absolute certainty, that something was wrong. She pressed her hands to her belly and waited for the familiar roll, the little kick against her ribs, the soft flutter that had become her nightly reassurance. Nothing happened. She waited 1 minute, 2 minutes, 5 minutes. She shifted positions, drank cold water, ate a cracker, all the tricks the nurses had taught her. Still nothing. Her husband woke up to find her sitting upright in bed, tears streaming silently down her face, whispering the baby's name over and over again. Lucas, they had already chosen. Lucas. She said his name like a prayer, like an apology, like a mother begging her child to answer her. They drove to the hospital at 4 in the morning, Eliana clutching her belly in the passenger seat, not speaking, not crying anymore, just staring straight ahead with that hollow look that I have learned to recognize in mothers who are preparing themselves for the worst. When she arrived at the labor and delivery unit, the nurse on duty later told me that Eliana's first words were not, "Help me," or "Something is wrong." Her first words were, "I think my baby is dying." I want you to pause here for a moment and think about what it takes for a mother to say those words out loud, to give voice to her deepest fear before any test confirms it, to walk into a room full of medical professionals and say, "I think my baby is dying," knowing that they might look at her with pity or doubt or clinical detachment. Do you think hope alone can sometimes keep a mother strong? Or does hope sometimes crack wide open to make room for something else entirely? Something raw and honest and desperate? The nurses put her on the monitor immediately, and for the first 30 seconds, the room was silent except for the static hum of the machine searching for a heartbeat it could not find. Those first 30 seconds felt like 30 minutes. The nurse adjusted the monitor straps around Eliana's belly, shifted the sensor, pressed a little harder. Still nothing. Just that hollow, empty static that every obstetric nurse dreads hearing in the middle of the night. Eliana's husband stood frozen by the bedside, one hand on her shoulder, his knuckles white. And Eliana didn't move. She didn't cry. She didn't ask questions. She just stared at the ceiling with the expression of someone who had already imagined this moment 1,000 times, and was now too exhausted to be surprised by it. Then the monitor beeped. A single, faint, irregular beat. Then another. Then a rhythm, weak, thready, but there. The nurse exhaled. Eliana's husband made a sound somewhere between a laugh and a sob. But Eliana kept staring at the ceiling, because she knew what the nurse hadn't said yet. The heartbeat was there, yes. But it wasn't right. It was too slow in some places, too fast in others, like a song being played by someone who had forgotten the melody. I got the call at 5:15 in the morning. The on-call resident told me they had a 28-week pregnancy with decreased fetal movement and an abnormal heart tracing. I was at the hospital in 20 minutes. When I walked into Eliana's room, I saw a woman who looked nothing like the glowing first-time mother I had met 2 months earlier. Her eyes were sunken. Her hands were shaking. And when she looked at me, she didn't ask for reassurance. She asked for the truth. So I gave it to her. I ordered an immediate ultrasound, not the quick bedside one but the full, detailed, let's see every vein and vessel kind. And as the sonographer moved the wand across Eliana's belly, I watched the images flicker across the screen and felt my chest tighten. The baby's heart was still beating, thank God. But something else was there. Something I had only seen a handful of times in my entire career. The umbilical cord, that lifeline between mother and child, was tied in a true knot. Not a false knot, not a loose loop, but a genuine, tightened, dangerous knot that had formed early in pregnancy and was now pulling tighter with every movement the baby made. But that wasn't all. As we scanned further, we saw something even more terrifying. The cord wasn't inserting into the center of the placenta like it should. It was attached to the membranes instead, a condition called velamentous cord insertion. The vessels were running unprotected through the amniotic sac, with nothing but a thin layer of membrane keeping them from rupturing. Between the true knot and the abnormal insertion, Eliana's baby was surviving on borrowed time. One wrong contraction, one sudden movement, one spontaneous rupture of membranes, and those vessels could tear. And if they tore, the baby would bleed out in minutes. I looked at Eliana's face as the sonographer explained the findings. And I watched something shift behind her eyes. Not fear anymore, but a strange, calm clarity. She had known. From the very beginning, she had known something was wrong. And now the machines had finally caught up to what her body had been telling her for weeks. Have you ever seen someone go through something emotionally similar? That moment when instinct becomes proof, when every quiet fear you dismissed as anxiety turns out to have been your child trying to warn you. Eliana didn't say, "I told you so." She didn't cry or scream. She just reached for her husband's hand and whispered 4 words I will never forget. "Keep my baby safe." The next 10 days were a waiting game that none of us were prepared for. At 28 weeks, a baby's lungs are not fully developed. Delivering immediately would save the cord from tightening further, but it would sentence that baby to weeks or months in the NICU, fighting for every breath on a ventilator. But waiting. Waiting meant keeping Eliana in that hospital bed, monitors strapped to her belly, nurses checking the fetal heart rate every 2 hours, hoping that the knot didn't pull tighter and the vessels didn't tear. Waiting meant watching every contraction like a ticking bomb. Waiting meant praying that today would not be the day everything fell apart. I sat down with Eliana and her husband in a small consultation room off the labor and delivery floor. The sun was coming up outside, pale and watery, the kind of morning that feels like it hasn't decided whether to bring light or storm. I laid out the options clearly. Steroid shots to accelerate the baby's lung development, just in case. Strict bed rest with continuous monitoring. And a plan. If the heart tracing showed any sign of distress, if her water broke, if she started bleeding, we would go to the operating room immediately, no questions asked. Eliana listened to every word with her hands folded over her belly, her thumbs tracing small circles where she could feel her son's occasional weak movements. Then she asked me a question that stopped me cold. She said, "Doctor, if this was your daughter sitting here, what would you tell her to do?" I have been asked that question many times over the years, and I have learned that there is no right answer. Because what I would want for my own daughter is not always what medicine would recommend. What a mother wants for her child is not always what logic would choose. I looked at Eliana's face, young, scared, fierce, and I told her the truth. I said, "If you were my daughter, I would tell you to fight. Not against the medicine, not against the plan, but against the fear. Because your baby needs you to be scared and brave at the same time. And that is the hardest thing any mother will ever do." She chose to wait. She chose to give her son those extra days, those extra weeks, praying that his lungs would grow strong enough to survive the outside world. And every morning, when I walked into her room for rounds, I would find her in the same position, propped up in bed, one hand on her belly, the other holding a small notebook where she wrote letters to her unborn son. She never let anyone read those letters. But sometimes, when the nurses weren't looking, I would see her lips moving silently, whispering to Lucas about all the things she wanted to show him someday. The ocean, the stars, the sound of his father's laugh. What would you have done in her place? Would you have chosen the immediate delivery, trusting the NICU to save your child? Or would you have waited, counting each day as a gift, knowing that every sunrise might also be a risk? There is no wrong answer. There is only a mother's love, bending and stretching and breaking itself into shapes that medicine cannot measure. On the 10th morning, Eliana woke up feeling different. She told the nurse that her baby felt too still again, not frantic, not struggling, just still. The monitor showed a heart rate that was dropping with every contraction, even the small ones she couldn't feel. I looked at the tracing and knew our waiting game was over. Whether his lungs were ready or not, Lucas was coming. And that was when the entire delivery room panicked. The decision to move to the operating room happened in less than 3 minutes. That's how fast things can change in obstetrics. One moment you're discussing options, and the next moment you're running down a hallway with a mother on a gurney, her husband jogging beside her, his face the color of paper. I remember the sound of Eliana's 4-pole rattling as we turned the corner. I remember the charge nurse calling out the time over the intercom. I remember thinking, please let us be fast enough. Please let us be fast enough, please. But here is what I did not expect. As we wheeled Eliana into the operating room, she reached up and grabbed my wrist. Her grip was surprisingly strong for someone who had been lying in a hospital bed for 10 days. She pulled me down close to her face and said, "If you have to choose between me and my son, you choose my son. Do you understand? You do not save me. You save him." I have heard mothers say those words before. I have heard them in quiet moments, in tearful conversations, in whispered prayers when they thought no one was listening. But I had never heard them said with that kind of cold, absolute certainty. Like Eliana had already made peace with every possible ending except the one where her baby didn't survive. I didn't argue with her. There was no time to argue. I just squeezed her hand and said, "Nobody is choosing today. You are both going to be fine." And then I walked into the scrub room and tried to convince my own hands to stop shaking. The anesthesiologist placed the spinal block while the nurses prepped Eliana's abdomen. Her husband was brought in wearing scrubs, looking young and terrified, and he sat by her head behind the surgical drape, holding her hand, whispering things I couldn't hear. The room was controlled chaos. Instruments being counted, lights being adjusted, the NICU team standing by with a warming bed and a tiny breathing tube. Every person in that room knew what was at stake. A true knot. A velamentous insertion. A baby who had already been fighting for weeks. And a mother who had already proven that her instincts were sharper than any machine in that hospital. I made the first incision at 9:47 in the morning. Eliana was awake, her eyes fixed on the ceiling, her lips moving silently. Praying, I realized. She was praying out loud without making a sound. Her husband was crying. The nurses were focused and silent. And I was moving as quickly as I safely could, layer by layer, until I reached her uterus and made that final incision to bring her son into the world. And then the room went silent. Not quiet. Silent. The kind of silence that happens when every person in a room stops breathing at the same time. Because when I reached into Eliana's womb and lifted her baby out, I saw something that made my own heart stop. The umbilical cord, that single fragile lifeline, was wrapped around his neck not once, not twice, but 3 full times. Tight, crushing, and blue. His tiny body was limp. His face was the color of a stormy sky. And he was not crying. He was not moving. He was not breathing. The NICU team rushed forward. The clock started. And in that moment, standing there with a silent baby in my hands, I understood what Eliana had known all along. Her son had not just been fighting for weeks. He had been fighting for his life every single second of every single day. Inside a body that could not protect him. Inside a womb that had become a battlefield. And now, in the bright lights of the operating room, with his mother's eyes watching from behind the drape, his fight had come to its final, impossible moment. 1 minute passed. Then 2. And still there was no sound. The NICU team worked like a pit crew at a race. One nurse was suctioning his tiny airway. Another was drying his limp body with warm towels, stimulating his skin, trying to trigger that instinctive cry that every baby is supposed to make. The respiratory therapist had the breathing tube ready, and the neonatologist was listening for a heartbeat that seemed to be fading with every passing second. I stood back with my hands still raised from the surgery, unable to look away, unable to breathe, unable to do anything except watch and pray. Eliana couldn't see what was happening. The surgical drape blocked her view, but she could hear. She could hear the absence of crying. She could hear the urgent whispers of the medical team. She could hear the beeping of the monitors that were not beeping the way they should. And she lay there, paralyzed from the chest down from the spinal block, unable to lift her head, unable to reach for her son, unable to do anything except grip her husband's hand and wait for someone to tell her whether her baby was alive. I will never forget what she said next. Her voice was barely a whisper, but in that silent operating room, everyone heard her. She said, "Lucas, please cry. Please cry for mommy. Please." The neonatologist started chest compressions. 1, 2, 3, 4, 5, counting aloud rhythmically, desperately. The baby's heart was beating, but barely. Slow. Weak. Like a candle flickering in a windstorm. The nurse checked the cord again. Those 3 tight loops around his neck, and I watched as the doctor carefully unwrapped each one, loosening the pressure that had been cutting off his oxygen for God only knew how long. Hours? Days. We would never know exactly when those cords had tightened. But looking at the deep grooves they had left in his skin, I knew it had not been recent. This baby had been choking slowly, silently, inside his mother's womb. for far longer than any of us wanted to admit. And Eliana had felt it. Every quiet struggle, every stolen breath, every moment he fought to survive while the rest of us told her everything was fine. The guilt I felt in that moment was crushing. I had sent her home. I had told her to rest and drink water. I had missed what her mother's instinct had been screaming at her for weeks. But there was no time for guilt. The clock was ticking. The baby's color was not improving. His heart rate was not stabilizing. And the neonatologist looked up at me with an expression I had seen before. That awful, helpless look that says, "I don't know if we can save this one." Then, at 1 minute and 45 seconds after birth, something happened that none of us could explain. The baby's hand, his tiny blue limp hand, curled into a fist. Not a reflex. Not a spasm. A deliberate, slow, determined clench of his fingers. The nurse saw it first and gasped. The neonatologist stopped counting compressions for half a second, just long enough to look. And then, before anyone could speak, Lucas opened his mouth and let out a sound so soft, so fragile, so impossibly small that it barely registered as a cry at first. But it was a cry. A real, living, breathing cry. And in that moment, the entire delivery room broke. That cry, that tiny, fragile sound, changed everything in the room. The neonatologist's hands, which had been moving with desperate urgency, suddenly slowed. The nurses exhaled. The respiratory therapist stepped back just slightly, the breathing tube still ready but no longer rushing. And Eliana let out a sob that came from somewhere deeper than her chest, somewhere primal and ancient. The sound of a mother who had been holding her breath for weeks and was finally allowing herself to exhale. But here is what I need you to understand. That cry was not a guarantee. It was not a miracle cure. It was a single breath, a single sound, a single flicker of life in a body that was still fighting against everything that had been stolen from it. Lucas was still blue. His heart rate was still dangerously slow. And those 3 loops of cord, now lying loose and limp on the surgical field, had left deep, angry grooves around his neck, purple indentations that told the story of how tightly he had been strangled inside his own mother's womb. The neonatologist handed him to the respiratory therapist, who placed a small mask over his nose and mouth, and began giving him gentle breaths. 1 breath, 2 breaths, 3. And with each breath, the color in his face changed, from that terrible stormy blue to a dusky purple, and then slowly to a pale pink. His heart rate climbed from 60 to 80 to 100. His arms, which had been limp and lifeless, began to twitch. His legs pulled up toward his belly, that newborn reflex that tells us the brain is waking up. I looked at Eliana's husband. He had his forehead pressed against hers, both of them crying silently, neither of them willing to look away from the small team of people working on their son. And I looked at Eliana's face, exhausted, terrified, hopeful. And I saw something I had only seen a handful of times in my career. Not relief. Not yet. But something closer to permission. Permission to believe that maybe, just maybe, her son was going to survive. The NICU team placed Lucas on a warming bed and wheeled him toward the door. Eliana reached out her hand, even though she knew she couldn't touch him, even though she knew he had to go. And as the bed passed by her head, something remarkable happened. Lucas turned his face, just slightly, just barely, toward the sound of her voice. His eyes were still closed. His body was still fighting. But something in him recognized her. Something in him knew that the voice saying his name was the same voice that had been singing to him, praying over him, begging him to stay alive for all those weeks inside the dark. The doors swung shut, and Eliana was alone in the operating room with her husband and the surgical team finishing her closure. She looked at me over the drape, her eyes red and swollen, her voice cracked from crying. And she said, "Did he cry? Did I really hear him cry?" I told her yes. I told her he cried, and he moved, and he was fighting. I told her those things because they were true, but also because I needed to believe them myself. Because standing there in that operating room, with the echo of that tiny cry still hanging in the air, I knew that the next hours would be critical. The next hours would tell us whether Lucas's brain had been deprived of oxygen for too long. The next hours would tell us whether he would survive, and if he did, what kind of life he would have. Some stories deserve to be remembered because they give hope to others. And standing there, watching Eliana's face as she repeated her son's name like a prayer, I knew I was in the middle of one of those stories. But I didn't know the ending yet. None of us did. The 60 minutes after Lucas was taken to the NICU were the longest of Eliana's life. And I know that because I sat with her while the surgical team finished closing her incision, while the nurses checked her vitals, while her husband made phone calls to family members who had been waiting for news. Eliana didn't want to rest. She didn't want to sleep. She didn't want to close her eyes for even a second, because closing her eyes felt too much like giving up, and she had spent the last 10 days refusing to give up on her son. I stayed with her because I couldn't leave. Not yet. Not until I knew. The NICU team had promised to call with updates every 15 minutes, and every time the phone rang, Eliana's whole body would tense, her hands would grip the bed rails, and her eyes would fix on my face as if she could read the news before I spoke it. The first call came at 10 minutes. Lucas was stable. His heart rate was holding at 140 beats per minute. His oxygen saturation was climbing slowly. He was not out of danger, but he was not getting worse. The second call came at 25 minutes. They had started him on cooling therapy, a specialized treatment where they lower the baby's body temperature to protect the brain from injury after oxygen deprivation. It was the right protocol. It was what any good NICU would do. But hearing the words brain injury and oxygen deprivation in the same sentence made Eliana's face crumple in a way I will never forget. She looked at me and said, "Is he going to know me? Is he going to know his mother's face?" And I couldn't answer her, because I didn't know. Nobody knew. The next 48 hours would tell us whether Lucas's brain had been damaged by those 3 loops of cord, by those weeks of silent struggle, by those minutes without enough oxygen. Her husband stepped out to get coffee, and Eliana grabbed my hand. Not hard, not desperate, just a quiet, steady grip, like she was holding on to something she was afraid to lose. She said, "Doctor, I need you to be honest with me. Have you seen babies survive something like this? Have you seen them come out the other side and be okay?" And I told her the truth. I said yes, I had seen it. I had seen babies who should not have survived walk out of this hospital in their mother's arms. And I had seen babies who fought for weeks and weeks and still didn't make it. I told her that there was no way to know which story Lucas would write. But I told her something else too. I told her that her son had already survived something impossible. He had survived a true knot, a velamentous cord, 3 tight loops around his neck, and minutes without breathing. That kind of fight, that kind of will to live, it meant something. It had to mean something. There are so many mothers carrying silent struggles nobody sees. Eliana had been carrying hers for weeks, smiling through clinic appointments, nodding when we told her everything was fine, going home to lie awake in the dark and count her baby's kicks like they were grains of sand slipping through her fingers. And now in this hospital room, with the monitors beeping and the fluorescent lights buzzing, she was still carrying it, still fighting, still hoping. The third call came at 45 minutes. Lucas had opened his eyes. Just for a moment. Just a flicker. But he had opened them. And when the nurse spoke to him, when she said his name in that soft, sing-song voice that NICU nurses use, he had turned his head. Not much. Not far. But enough. Enough to show them that something in there was reaching toward the light. Eliana closed her eyes and whispered something I couldn't hear. Then she opened them and looked at me and said, "I want to see my son. Right now. I don't care if I'm still numb. I don't care if I have to be wheeled there in my bed. I need to see his face." And that was when I knew. This mother was not going to break. This mother was going to walk through fire if she had to, and she was going to carry her son out the other side. We wheeled Eliana into the NICU exactly 52 minutes after she asked. Her bed rolled slowly through the double doors, past the rows of incubators and monitors and tiny babies fighting their own silent battles. The NICU is a strange place. It is full of the most fragile kind of life, and yet it hums with a quiet, desperate kind of hope. Every parent who walks through those doors is praying the same prayer. Every nurse who works those long shifts is holding the same belief. That these small bodies are stronger than they look. That these small hearts know how to keep beating even when everything says they shouldn't. Lucas was in the far corner, in a specialized cooling bed that kept his body temperature at exactly 33.5 degrees Celsius. He was tiny, just under 4 pounds, and his skin was still pale, still fragile looking, still marked with those purple grooves around his neck where the cord had been wrapped. Tubes and wires covered him like a web. A ventilator breathed for him in slow, steady rhythms. And his eyes were closed and still, like a small doll lying in a bed too big for his body. Eliana reached out her hand and placed it through the porthole in the incubator. Her fingers touched his chest, so gently, so carefully, like she was afraid he might break. And then she started to sing. A lullaby. Soft and low and slightly off-key. The way mothers sing when they are too tired to remember the right notes. Her voice was hoarse from crying, cracked from exhaustion, but she sang anyway. She sang about the moon and the stars and a mama who would always be there. She sang the same song she had been singing to her belly for all those weeks, the song she had whispered in the dark when she couldn't feel him move, the song she had used to fill the silence when her fear was too loud. The NICU nurses kept working around her, checking monitors, adjusting medications, documenting every breath and every heartbeat. But I saw one of them pause. I saw her look at Eliana's face, at the tears streaming down her cheeks, at the way her fingers traced small circles on her son's chest. And I saw something shift in that nurse's expression, that look of professional detachment cracking open, just enough to let something human slip through. And then it happened. Lucas's hand. His tiny, pale, fragile hand moved. Not a reflex. Not a startle. A slow, deliberate, reaching movement toward the warmth of his mother's fingers. His little fingers curled around Eliana's pinky finger and held on. Not tight. He didn't have the strength for tight. But he held on. And then his eyelids fluttered. Once. Twice. And then they opened. Those eyes, dark blue, still cloudy, still unfocused, looked up at the source of the voice they had been hearing for weeks. Looked up at the face they had never seen but somehow already knew. And Lucas, this baby who had been starved of oxygen, who had been strangled by his own cord, who had been born limp and blue and silent, Lucas smiled. Not a gas smile. Not a reflex. A real, slow, impossible smile that spread across his tiny face like sunrise. The nurse gasped. The respiratory therapist stopped what he was doing. And I stood there, 32 years into my career, watching a 4-pound baby smile at his mother, and I could not find any medical explanation for what I was seeing. Babies on cooling therapy do not smile. Babies with his APGAR scores do not track voices. Babies who went as long as he did without oxygen do not reach for their mother's fingers. But Lucas did. Lucas did all of it. Eliana looked up at me with tears pouring down her face, and she didn't ask me to explain it. She didn't ask me if it meant he would be okay. She just smiled back at her son, and kept singing. And in that moment, every person in that NICU knew they were watching something that belonged in a different category entirely. Not a medical case. Not a clinical outcome. A miracle. Small and quiet and impossible, but a miracle all the same. The next 48 hours were what the NICU team called the watching window. That's the period when they monitor a cooling therapy baby for signs of brain injury, seizures, abnormal reflexes, uneven pupil responses, anything that might indicate the oxygen deprivation had caused permanent damage. Every hour brought new tests, new assessments, new moments of holding breath while waiting for results. And through all of it, Eliana did not leave her son's side. She slept in a chair pulled up next to his incubator. She ate meals with one hand while the other rested on his tiny feet through the porthole. She talked to him constantly, about his father, about their home, about the nursery they had painted pale blue, about the stuffed bear waiting on his dresser. The nurses told me later that Lucas seemed to calm whenever he heard her voice. His heart rate would stabilize. His oxygen levels would rise. His little body would relax in a way that no medication could achieve. They had seen it before. That mysterious connection between mother and baby, The way a familiar voice and a familiar scent could reach into a child's unconscious mind and tell him he was safe. But even the most experienced NICU nurses admitted that what they witnessed with Lucas felt different. Stronger. More real. On the second day, they rewarmed him slowly, raising his body temperature back to normal over several hours, watching for any sign of seizure activity. Eliana sat beside him through the entire process, her hand never leaving his, her voice never stopping. She told him stories about his grandparents, about the dog waiting at home, about the first time she felt him kick and how she had laughed out loud in the middle of a grocery store. She told him about the night she found out he was a boy, and how his father had cried. She told him about the letter she had written him when she was 28 weeks pregnant, the one she kept folded in her pocket, the one that said no matter what happened, she would always be his mother. And Lucas listened, with his dark blue eyes open now more often than closed, with his tiny fingers wrapped around his mother's pinky, with his chest rising and falling in steady rhythms that the ventilator no longer needed to support. Lucas listened. If stories like this touch your heart, moments like these remind us why these stories matter. Because in a world full of statistics and prognosis and medical uncertainty, there is still something unexplainable about a mother's love reaching through an incubator and pulling her child back from the edge. On the third day, the neurologist came to do the final assessment. Eliana's husband had returned from work, and both of them stood beside the incubator, holding hands, waiting. The doctor checked Lucas's pupils, equal and reactive. His reflexes, strong and symmetrical. His muscle tone, improving every hour. And then the doctor did something that made everyone in the room hold their breath. She placed a small bell near Lucas's right ear and rang it softly. Lucas turned his head toward the sound. Then she rang it near his left ear. He turned again. Then she spoke his name, just a normal voice, no louder than conversation. And Lucas turned his face toward her and blinked, slowly, deliberately, like he was saying, "Yes, I hear you, I understand." The neurologist looked at Eliana and smiled. A real smile, not the careful, measured expression doctors learn to wear. She said, "I don't have a medical explanation for this. By every measure we have, this baby should have significant brain injury. But I'm not seeing it. I'm not seeing any of it. Whatever you did in that operating room, whatever you did in this NICU, keep doing it. Because it's working." Eliana didn't say anything. She just reached into the incubator, lifted her son's small body with hands that had been waiting for this moment for 3 days, and held him against her chest for the very first time. Skin to skin, heart to heart, mother to son. And Lucas, this impossible, fighting, miraculous little boy, let out a soft sigh and closed his eyes. Finally safe, finally home. Eliana walked out of our hospital 18 days after Lucas was born. Not in a wheelchair, though we offered one. Not leaning on her husband's arm, though he was right there beside her. She walked out carrying her son in a baby carrier against her chest, his tiny face peeking out from under a blue knit hat, his dark blue eyes wide open, and watching the world with a curiosity that made every nurse who saw him stop and smile. The NICU team lined the hallway to say goodbye. The same nurses who had held Eliana's hand during the worst nights. The same respiratory therapist who had breathed for Lucas when he couldn't breathe for himself. The same neonatologist who had said the words, "I don't know if we can save this one." There were tears. There always are on days like that. But these were different tears. Not the tears of fear or grief or uncertainty. These were the tears of people who had watched something impossible unfold in front of them, and had been changed by it. Because that is what hope does when it shows up in a hospital. It changes everyone in the room. I stayed in touch with Eliana after she went home. She sent me photos every month. Lucas at his first birthday, smashing cake into his face with both hands. Lucas at 2, running through the sprinklers in their backyard. The purple grooves around his neck long since faded to faint white lines that you could only see if you knew where to look. Lucas at 3, sitting on his father's shoulders at the zoo, pointing at the giraffes and laughing with a sound that filled up every quiet space around it. And every photo came with a note. "Thank you for not giving up on us. Thank you for listening when I was scared. Thank you for letting me be his mother." But here is the truth. I didn't do anything extraordinary. The NICU team did their jobs. The surgeons did their jobs. The machines and the medications and the protocols did what they were designed to do. But the extraordinary thing, the thing that no textbook could explain and no training could replicate, that came from Eliana. It came from a mother who refused to dismiss her own instincts, who refused to stop believing that something was wrong even when every test said everything was fine, who lay awake in the dark counting her baby's kicks like they were prayers, who whispered to her son for weeks when nobody else could hear him, who looked at a room full of medical professionals and said, "If you have to choose, you choose my son." Not every miracle happens loudly. Some miracles happen quietly inside hospital rooms, in the space between a mother's whisper and a baby's first cry, in the moment when a tiny hand curls around a finger and a heart that should have stopped keeps beating anyway. If you believe stories like these deserve to be heard, you're always welcome here, because there are so many mothers carrying silent struggles nobody sees, so many babies fighting battles nobody knows about. So many moments of impossible hope happening right now, in delivery rooms and NICUs and hospital beds all over the world. And every single one of them matters. What Eliana taught me, what I carry with me into every exam room, every delivery, every conversation with a scared mother, is this: listen to her. Not just to her symptoms or her test results or her vital signs. Listen to her when she tells you something is wrong. Listen to her when she says her baby feels different. Listen to her when she uses words like, "I think," and "I'm afraid," and "I just know." Because that voice, that quiet, persistent, sometimes inconvenient voice, is not anxiety. It is not overreacting. It is the oldest instinct in human history. The one that has been keeping babies alive since the very first mother held the very first child in her arms. Lucas is 6 years old now. He is healthy and happy and beautifully, perfectly ordinary in every way that matters. He reads above his grade level. He plays soccer on Saturdays. He tells his mother he loves her at least 12 times a day, which she says is exactly enough to make up for every moment she spent wondering if she would ever hear his voice. And sometimes, when I am having a hard day, when I am tired and overworked and questioning why I chose this impossible profession, I pull out the photo Eliana sent me last Christmas. It shows Lucas in a too big Santa hat, grinning at the camera with 2 front teeth missing, holding a sign that says, "Thank you for believing I could make it." I look at that photo, and I remember the silence before the storm, the mother who knew before anyone else, the monitors going silent, the longest 60 seconds, and then the smallest sound that changed everything. That is why I still show up. That is why I still listen. That is why I will never, ever tell another mother to stop trusting what her body is telling her. Because sometimes the impossible is just a miracle.